My name is Paul Hunt. I work at the University of Essex in the United Kingdom, also partly based at the University of Waikato in New Zealand, and from 2002 through to 2008 I was the so-called UN Special Rapporteur on the right to the highest attainable standard of health. The main issue I wanted to get across was that there is a basic fundamental human right called the right to the highest attainable standard of health, and health promotion falls within that human right. So states and others have legally binding obligations to engage in health promotion. It's not something that's an optional extra. It's not something that's incidental or marginal. It's something they're required to do, to engage in health promotion as part of operationalizing the right to the highest attainable standard of health. Sure. There is something called the right to the highest attainable standard of health, which every country on the planet has signed up to one or other human rights treaty which encompasses the right to the highest attainable standard of health. And so there are binding obligations on states to take all reasonable measures to implement the human right to the highest attainable standard of health. There are other human rights that are very relevant to good health. I mean, for instance, if you wish to really talk about health policies, you've got to have the ability to speak freely. That's freedom of expression. So there are a number of human rights that bear upon health. The right to health is the most central, but there are other human rights that are extremely relevant to health status and good health outcomes. I think one of the greatest challenges is to get health promotion professionals familiar with human rights and engage with human rights. And that's why I was so pleased to be invited to this event, because it was an opportunity for me to speak to a large number of wonderfully committed and trained health professionals who work on health promotion. So I was able to introduce some of them to the human rights dimensions of their work. And that's terribly important. You know, I'm a lawyer, right? And health professionals need to hear from health professionals about human rights. So by speaking to the participants today, I'm hoping that some of them will be interested, some of them will wish to familiarize themselves with the human rights dimensions of their work, and will talk with their co-health professionals. What I'm struck with, again, it's not sort of new, but it's good to have it reaffirmed, is that there is enormous common ground between, on the one hand, health professionals, and on the other hand, as it were, human rights professionals. You know, many of them are committed to social justice. Many of them are committed to trying to alleviate avoidable human suffering. So there's huge common ground, and I've been reminded of this again by listening to speeches here and by talking to the health professionals who are here. And we have to capitalize on that common ground. And instead of focusing on the differences, the different concepts, and the different training, instead of doing that, I think we need to focus on the very extensive common ground between human rights workers and health workers. And in effect, a health worker actually is a human rights worker. For me, a central message is please try to use human rights as appropriate in your work. And what's going to be appropriate for one organization won't be appropriate for another organization. I understand that. There are different organizations with different objectives, different modalities. But nonetheless, in my opinion, every organization working in health can use human rights in one way or another. So I'm hoping that a message that will be heard is that all health professionals should reflect on how they're going to use human rights as a tool, as an asset, as an ally in fulfilling their professional objectives. I can't give a definition, but amongst the components of health promotion are things like the imperative of community education, of community participation, and taking seriously social determinants.